name is Skylar Calzadia, and I am an ASN, RN, and BSN student at St. Petersburg College of Nursing. Today, I will be presenting my literature review on prevention of venous thromboembolism in hospitalized patients. This presentation will review current research related to the strategies used to prevent venous thromboembolism, including evidence-based interventions and their impact on patient outcomes. Thank you for taking the time to view my presentation. I will begin by discussing the background and importance of VTE prevention in hospitalized patients. Venous thromboembolism, or VTE, is a serious complication that can occur during hospitalization and includes conditions such as deep vein thrombosis and pulmonary embolism. Many hospitalized patients have increased risk factors for developing VTE due to factors such as decreased mobility, surgery, acute illness, and prolonged hospital stays. Preventing these events is an important aspect of improving patient safety and outcomes. The purpose of this literature review is to examine current research on VTE prevention strategies in hospitalized patients. This review will analyze findings from recent quantitative research studies to better understand which interventions are most effective and how these findings can be applied to nursing practice. The guiding research question for this review is, what interventions are most effective in preventing venous thromboembolism among hospitalized patients? Venous thromboembolism, or VTE, is a serious and potentially life-threatening condition that includes deep vein thrombosis or pulmonary embolism. VTE occurs when blood clots form in the veins and can lead to severe complications, including sudden death from pulmonary embolism. VTE is a significant healthcare concern with up to 900,000 people in the United States affected each year and an estimated 60,000 to 100,000 deaths annually. Hospitalized patients are at increased risk due to factors such as reduced mobility, surgery, acute illness, and prolonged hospital stays. Although many VTE events are preventable, gaps remain inconsistent. Risk assessments, timely use of prophylaxis, and implementation of evidence-based prevention strategies. Improving prevention practices is important to reduce complications and improve patient outcome. This topic is especially significant in nursing practice because nurses are responsible for identifying patient risk factors, monitoring for signs of VTE, promoting mobility, ensuring preventative measures are followed, and providing patient education. Nursing interventions play an important role in reducing preventable VTE events and improving patient safety. The number for the 900,000 is found in Centers for Disease Control and Prevention, the CDC 2024. A literature search was conducted using PubMed, CINHL, and Google Scholar to identify current research related to the prevention of venous thromboembolism in hospitalized patients. The search includes terms such as venous thromboembolism prevention, VTE prophylaxis, hospitalized patients, and thromboprophylaxis. Limiters were applied to narrow the search results, including peer-reviewed articles published within the last 5 years, English language studies, full text availability, human subjects, adult populations, and quantitative research designs. Studies were excluded if they were systematic reviews, meta-analysis, mixed method studies, or focused on non-hospitalized patients. After reviewing the available studies, 3 primary quantitative research articles were selected based on the relevance, study design, and ability to address VTE prevention strategies in hospitalized patients. The first article reviewed was an experimental randomized control study, which is considered level 2 evidence on the hierarchy of research evidence. The study compared aspirin with low molecular weight heparin for preventing venous thromboembolism in 12,211 hospitalized orthopedic trauma patients with fractures. The researchers found that aspirin was non-inferior to low molecular weight heparin, or LMWH, for preventing death after injury. Both groups had similar rates of pulmonary embolism and bleeding complications, although the aspirin group had a slightly higher rate of DVTs, or deep vein thrombosis. These results suggest that aspirin may be an effective alternative to LMWH for some patients, but prevention strategies should still be individualized based on patient risk factors. A limitation of this study is that it focused on orthopedic trauma patients, so the findings may not apply to all hospitalized populations. The citation from this article is by O'Teal and other authors in 2023. The second article was a randomized controls trial, which provides level 2 evidence. Researchers compared extended thrombophylaxis rivaroxaban to no anticoagulation in 320 high-risk patients after hospitalization for COVID-19. The graph shows the percentage of patients who experience thrombotic events within 35 days after discharge. The rivaroxaban group had fewer events, with 3% of patients experienced a clotting-related outcome compared with 9% in the group that received no anticoagulation. These findings suggest that extended rivaroxaban therapy may help reduce the risk of VTE complications in high-risk patients after hospitalization. However, more research is needed to determine which patients benefit most from extended anticoagulation while avoiding unnecessary treatment risk. This is found from Ramaciotti with other authors in 2022. The third article is a study that examined the effectiveness of a nurse-led bundled care intervention for preventing deep vein thrombosis in immobilized neurosurgical patients. The researchers used a quasi-experimental design comparing patients who received standard care with patients who received a structured VTE prevention bundle. The nurse-led bundle included 4 main components: dynamic VTE risk assessment, mechanical prophylaxis using compression devices, patient education, and individualized early mobilization. These interventions were designed to address multiple risk factors for blood clot formation in patients with limited mobility. The study found that implementing a nurse-led prevention bundle improved VTE prevention practices and supported better patient outcomes. These findings demonstrate how nurses play an essential role in recognizing VTE risks, improving adherence to prevention measures, and reducing complications associated with immobility. Although the results support the use of a bundled approach, a limitation is that the study was conducted at a single hospital using a historical control group. Future research across multiple healthcare settings is needed to determine if similar outcomes can be achieved in other hospitalized patient populations. While these studies provide important evidence on preventing venous thromboembolism, there are still some limitations within the current research. One limitation is that each study focused on a different patient population, including orthopedic trauma patients, patients recovering from COVID-19, hospitalized and immobilized neurosurgical patients. Because these groups have different risk factors and healthcare needs, the findings may not apply equally to every hospitalized patient. Another limitation is that some studies were conducted in specific hospitals or healthcare systems, which may affect how well the results can be applied in other settings. More research involving a wider variety of patients and multiple healthcare facilities would help determine which VTE prevention strategies are most effective across different populations. Overall, the current evidence supports the importance of individualized VTE prevention, but continued research is needed to help guide consistent practices and improve patient outcomes. My citation is all 3 articles that I used: Chen et al. 2026, O'Toole and other authors 2023, and Ramaciotti and other authors in 2022. Here is the conclusion to the VTE PowerPoint. Overall, the research shows that preventing venous thromboembolism is an important part of safe patient care and requires an approach that is specific to each patient's risk factors and health needs. The 3 studies show that different prevention methods, including medications, mechanical methods, and nurse-led care interventions, can help lower the risk of developing dangerous blood clots. Nurses have a major role in preventing VTE by identifying patients who are at higher risk, educating patients about prevention, encouraging movement when appropriate, and making sure prescribed prevention measures are being followed. These actions can help reduce complications and improve patient outcomes. The current evidence and clinical guidelines support using a combination of prevention strategies while considering each patient's risk of both clotting and bleeding. This is found in Schneemann with other authors in 2021. However, more research is still needed to determine the best approaches for different patient populations and healthcare settings. Future research should focus on including more diverse groups of patients, studying long-term outcomes, and finding ways to make VTE prevention practices easier to apply consistently in nursing care. Thank you for listening to my presentation on the prevention of venous thromboembolism. I hope that you found it informative. It's been a wonderful semester, and I wish everyone the best in nursing school BSN and their future careers. Thank you so much.